Good afternoon, everybody. Thank you very much for joining us today here at Healthmonics. We are putting on a webinar that is Unlocking Success with MIPS Value Pathways. It is the new pathway for reporting your quality data as well as your other MIPS data that you're used to reporting. Started in 2023, and we will be really ramping up and sharing a lot of information to see if this is an option for you in 2024 and moving forward. Today, I am being joined by Mara Flaherty, our MIPS specialist here. Hi, Mara.
Hi, Mike. Thanks for having me.
You got it. And we will be going over everything in detail. A couple of items for you. First off, it looks like GoToWebinar did change how their setup is. So if you have the new platform, this might not look familiar to you. But in the top right-hand corner, you can see a little box with question marks, and you could ask your questions in there. If we have the opportunity at the end of this call, we may answer some of the questions. Otherwise, you'll sure to hear from me in the near future with the answer to your question. So please ask away. Also, there is availability to download the file, including all of the slides. If you click the little button with the paperclip up at the top, you'll see the different handouts that we have. And one of them, the one that says MVPs, is the one that is for the slide deck. So you'll have the slide deck. I will also be sending everybody the slide deck at the end of the call sometime this afternoon. I'm going to toss it over to Mara and we're going to get started.
All right. Thanks, Mike. Thanks again, everyone, for joining today. We're really looking forward to having everyone and discussing MVPs for 2024. So just a really quick overview of what we're going to cover today. I'll go through a very brief intro on traditional MIPS and then dive right into MVPs, understanding what they are, where they're going, and then moving on to kind of navigating the MVP landscape, and then finally looking at performance and scoring through MVPs. So first step in determining your strategy for MIPS reporting in 2024 will just be simply checking eligibility for each provider in the group. So this can be done directly through visiting the QPP website. You're going to want to input just individual NPI numbers for your providers. And that will pop back with your MIPS eligibility and requirements for 2024. So in terms of scoring for 2024 for this year, the overall MIPS score, as it has always been, will be out of 100 points. And then again, same as last year, providers who score exactly 75 points will receive a neutral payment adjustment. Those who score lower than a 75 will receive a negative adjustment, and those who are above the 75 point threshold will receive an incentive payment. And for the 2024 performance year, those payment adjustments will be seen in the year of 2026. So participation options for MIPS and MVPs. In traditional MIPS, you all are probably aware and familiar, your options are individual or group reporting, but MVPs are adding in additional options. So just kind of going down the line here, as an individual, so one provider, your options for reporting are traditional MIPS or MVPs. As a group, same thing. You can report traditional MIPS or an MVP. Virtual groups are only able to submit traditional MIPS, so they're not eligible for MVP reporting. And then APM entity are eligible for traditional MVP or the APM performance pathway or APP. And then the subgroup is the new addition for 2024 that aligns with MVPs. So subgroups can't be reported through traditional MIPS, but it is a new reporting option that's available through the MVP option for 2024. So here's just a quick reminder of category weights for traditional MIPS. The left chart here represents the weighting for small practices who have PI automatically reweighted. So that will result in cost being worth 30% of the score, quality is worth 40, and then IA is worth 30%. So for small practices of 15 providers and fewer, PI is automatically reweighted, but if you want to report PI as a small practice, you can. So you would be able to opt in to report PI, but if you don't, this is what your weighting will look like. And then on the right hand side, if you were also reweighted in the cost category, here's what your category weights would end up looking like. And so it's just a 50-50 split between quality and IA. And we do want to remind everyone that cost is not, nobody is exempt from the cost category. So we'll end up depending on the specialty and provider type on whether or not you have cost measures associated with you. And the best way to determine that will be confirming directly with QPP, but we don't recommend assuming that anyone is cost exempt. So that was for small groups. This is going to be for large groups of 16 or more clinicians. So more often than not, most large groups are going to be accountable for all four categories. And if that is the case, the weighting you'll find in that scenario will be on the left, the standard weighting. Same it's been for the past few years. You're going to be looking at equal parts cost and quality, and then PI is worth 25% and IA is worth 15. In the middle here, this is going to represent if a large group was PI exempt, and that can happen for a handful of reasons. Provider type and specialty are big factors in that. So, for example, non-patient facing providers are automatically PI exempt. And then again, specialty will play a part in that as well. And again, confirming with QPP if you fall into any of those categories is going to be your best way of knowing. And we can also help you out with that piece of it as well. So if a large group was PI exempt, their weighting looks a little different. Quality is going to be worth 55, cost is worth 30, and IA is worth 15%. And then finally on the right, this shows an example where a large group has cost and PI related. So we're going to be a large emphasis on quality at 85% and then 15% at IA. So now we're going to get into MVPs, understanding what they are and where we go from there. So just a quick look at the landscape of MVPs and traditional MIPS, so kind of where we've been and where we're going. Um, CMS hasn't confirmed a specific date or performance year for this, but they have made it clear that in the future, MVPs will become mandatory. So again, no specific date, but MVPs are the future, and that's what we've been understanding for the past couple years. So obviously 23 was the first year MVPs were available. We're now in 24. And then the other thing to note here is that by 2026, if you're a multi-specialty group that chooses to report through an MVP, you will have to report through subgroups within an MVP. So those are the big points here. And again, we expect to see the sunsetting of traditional MIPS and MVP being essentially the new alternative to traditional MIPS. So what are MVPs? They are the newest reporting option. Again, started 2023 was the first performance year that they were available. They've expanded in 2024 to offer a few new MVPs, but essentially they are a subset of measures and activities all related around a given specialty or medical condition. So the goal is to have them, again, around a specialty so that measures are more relevant to things that these groups might already be doing. And this link here on the slide deck will lead you to an extensive list of all of the MVPs that are available for this year. So am I required to report MVPs? No. So as of this year, 2024, nobody is required to report MVPs. So the option for traditional MIPS or APP, which is the APM performance pathway, those are all still available and reportable for 2024. Like I said, the future CMS has indicated that that will not be the case, but as of now, it's just an option, not a requirement. All right, so diving into MVPs and looking at the specific MVPs, um, and then going from there to see what might make most sense from your practice. All right, so this is a list of all of the MVPs that are available for 2024 reporting. I won't go through all of them. They'll be available in the slide deck, and they're also available on the QPP website with all the details and information you would need about them. There are 16 available for reporting this year in 2024. That is more than were available in 2023, and we assume that CMS will continue adding more and more each year, hopefully including additional specialties and provider types. But again, these are all of them for 24, and they're all available on our website and on QPP website as well. So small practices, as it relates to MVPs, it's going to look pretty similar to traditional MIPS. So there are the same bonus points and incentives for the most part that you will have seen in traditional MIPS. And again, a small practice is a group with 15 or fewer providers. So if that is you, and you do choose to report an MVP this year, you'll continue to receive the 6 bonus points in quality as long as one measure is submitted. And again, that's the same as in traditional MIPS. You'll also receive 3 points for a quality measure that either doesn't have a benchmark or that you don't meet the case minimum for. Same as in traditional MIPS. And then in the PI category, for small practice, it will be the same thing, automatic reweighting of the PI category for MVPs. And then I am going to turn it over to Mike.
Hey everybody. All right. So why should you transition to reporting MVPs before they are required? Just like other programs, just like being the first to adopt back in the day PQRS and then MIPS, those who did it earlier were more comfortable with the programs moving forward, as well as there are abilities to really understand the program and getting ahead of it. And incentive wise, gives you a better chance to score. So here are a couple of the benefits. These are laid out by CMS, and this is really the reasons why they have the program. More connected assessment of your quality care. So each MVP basically is built with a condition or a specialty in mind, or multiple specialties in mind. You could see that from the list that was on the earlier screen that Mara went over. Really, the ability to understand, what you are doing compared to your peers instead of a lot of times from when I talk to groups that have been reporting MIPS for a while, one of the biggest complaints is that why am I putting in measures like the flu and pneumonia measures, or advanced care plan that are so general when I could be utilizing this information and reporting on quality measures that are closely assigned with what I'm physically doing within my practice. So the goal of CMS is to get us there, and this is their next step. Streamline, reduced set of measures and improvement activities. The improvement activities, you could say, uh, it could be harmful that they're reducing your options for an MVP. However, they also are reducing, if you're a large practice, how many MVPs that you need to do. But from a measure standpoint for MIPS, now it's 4 measures for you, which is fantastic. So it will give you your best 4 measures instead of your best 6 measures. So if under traditional MIPS you're reporting 8, 9, 10 measures, CMS will take your highest 6, including your outcome measure. But now with the MVP, they'll take your highest four. So it's really just eliminating the bottom two measures that you've been reporting. The performance feedback is actually really important. And I think a lot of this not only is aligned with MVPs starting, but it also is aligned with getting rid of the COVID exemptions and so forth, being able really to see where this program goes and where this program can be successful in. So having CMS provide similar feedback and comparisons between clinicians that are alike and that are reporting on the same measures will be more beneficial than you really not being compared apples to apples across the entire spectrum of your practice. So an opportunity also to become more familiar. So this is where I was talking about just a minute ago, but really becoming more familiar before they are mandatory. There are a lot of people that are getting back into traditional MIPS today that haven't been doing it through the exemption years, that are a little in shock, to say the least, of the difference in the program now compared to when it was 3 or 4 years ago, where the minimums were 30 points to avoid the penalty, where cost wasn't really an issue or or a concern. Measures, there was an abundance of measures with opportunities to report on a lot of things. Uh, those who have been doing it through the pandemic and still reporting or tracking at least had the opportunity to see what the cost impacts were, what are the new measures, what are the abilities of your practices, and how they can report moving forward. And that's only going to help you as you moved further and further along into the opportunities of MVPs and even future opportunities as CMS is utilizing MVPs to really give you a chance to see what your data looks like and see what the programs like ACOs and other enhanced programs that CMS will be coming out with. This is a stepping stone for that, to play with and look at this data now, so that as we are becoming more and more involved in value-based care instead of pay for performance, as we've been moving in this direction, uh, that this is a great stepping stone to those who are thinking about moving towards other advanced programs. So what are my participation options, or what are your participation options for reporting MVPs? So we discussed it a little bit earlier, but just wanted to break it down in more detail. So you can report an MVP as an individual. Select this option to register a single clinician to report an MVP. You can register to report an MVP as an individual, and in addition to reporting an MVP as part of a group or a subgroup. So uh, you can break your providers down in so many different levels to maximize the opportunities for scoring. So the other option here on this page is group reporting. When you're doing group reporting, it's exactly the same as it's been for MIPS reporting in the past. It will include everybody that's in your practice needs to be part, every eligible clinician needs to be part of group reporting for the entire practice. Subgroup reporting, that is the new feature that is only for MVPs. This gives you the chance to report on a group of clinicians that is less than your entire practice or TIN and more than the individual. So in the past, a lot of people would ask, well, under traditional MIPS, can I just report these five providers or these five clinicians, sorry, that have um, one, that are scoring the highest? Can I put them all in a group and report on them? And the answer for traditional MIPS is no, you can't do that. You need to either report as an individual or as a group. Subgroups were not an option moving forward. Now, subgroups for MVPs are available. This gives you just another outlet or another pathway for you to maximize the high performers or to really understand moving forward what CMS is looking at that every multi-specialty group will need to report on subgroups moving forward. The other option here too is that APMs entities will need to register as an APM entity, or can register as an APM entity to report an MVP. So just like they could for traditional MIPS, MVPs will be available for APM entities. Can a clinician report multiple MVPs? So yes, a clinician can participate in multiple ways to report multiple MVPs. So for an example, the entire group of internal medicine clinicians can participate as a group for reporting the optimizing chronic disease management MVPs. A subset of those clinicians can then participate as a subgroup to report on, and then they can also report as an individual. So someone could technically have multiple scores for the same practice, and CMS will take the highest of those scores. The only one that is kind of left out on the corner here is if they happen to be part of a virtual group, which is a very small number of clinicians. That will supersede any of these programs for scoring. So those that aren't part of a virtual group will have the ability to score individual, subgroup, uh, group for MVPs, as well as reporting as a group or an individual through MIPS, and CMS will take the highest of those options. Can a clinician report multiple subgroups? No. A clinician can only participate in one subgroup per practice. That's the important part here. You can report as multiple different subgroups if you're part of different practices. But if you're under one practice, you cannot report in two different subgroups. You can report an MVP and a subgroup, but you cannot report under two subgroups at this time. Future rulemaking may change that, but for right now, you cannot. Maximizing performance and outcomes. So here, a little bit of background of what it's really going to take to understand what the requirements are and how you're going to report. So understanding the requirements. Familiarize yourself with the specific performance categories such as quality, promoting interoperability, improvement activities, and costs. I mean, if you've been doing MIPS for a long time, it's the same categories under MVPs. Stay up to date on the scoring system and performance benchmarks, understanding what measures there are opportunities to score points on. Something that we've written about in a blog that our CEO Lauren Patrick wrote about in a blog is that the fact that there's only 40 or so measures currently for CQMs which are clinical quality measures reported through a registry, that have benchmarks and aren't topped out at 7 points. So there's very few measures that you really can maximize your points on. So understand that today is better than trying to figure this out in November and December. Establish measurable and achievable performance goals for each MIPS category. Understanding that you want to maximize your improvement activities, that's we always check that off as the easier one, right? You also have the ability to maximize your promoting interoperability, understanding your cost data and making sure that you are where you need to be for cost. We have a tool, the MIPS Cost Analytics, which is a proprietary tool here at HealthMonix that allows you to look into your cost score. And then also, when it comes to quality, don't track 4 measures, track 6 or 8. Track measures that can really help you get where you need to be. There are a number of measures under each one of these MVPs that you can choose from. And then align your goals with your practice and overall mission. Is your goal to participate and to improve on quality of care? Is it to score well? Is it to play with MVPs in 24 and then be fully engaged in 25? What does that look like for your practice? Set those goals up and keep them in mind throughout the year. prioritizing measures. We've talked a lot about that so far, but really understanding that, you know, you're down to four measures and you could pick really great four measures moving forward. The MVPs have added a number of measures in the past year. I would say in 2023 MVPs, there were a number of them that weren't really worth doing because they didn't have the measures that added in. Now there's a little bit better opportunities. Optimize data to make sure that you are collecting all of the information, utilizing supplemental data, making sure that you are tracking throughout the year to understand what improvements are needed. Do you have a certain clinician, or do you have a certain group or location that are holding your scores back? Really understanding what that looks like and utilizing your whole year to really track that. Uh, Leveraging your EHRs. Many people on this call right now have an EHR, or have some type of technology solution that can really drive your performance. So understanding what you need to do, what as a clinician they need to do, what buttons they need to press to give the maximum result. PI, it's coming. There are a number of new rules for promoting interoperability. You'll see added for 2024 that the only clinician type that is exempt from PI from a clinician standpoint are your social workers. So that means that those that were getting it before, mainly psychologists are one, and some other category, I think obstetrics, they are no longer exempt from promoting interoperability starting in 2024. So be careful and understand what that looks like for you. IA, as a large practice, you'll have the opportunity to report on a little bit less of the improvement activities. However, there are great improvement activities under each one of these categories, and one of them is really utilizing MVPs. So you'll be able to use that under each one of the MVPs. And then managing and monitoring your costs. We'll get into a little bit more detail about what the difference between traditional MIPS cost and MVP cost. However, it is important for you to really understand it because, as we've stated a number of times through articles and conversation, there is no way to get a perfect score in MIPS during submission because you're waiting on 30% of your score to come from the cost category. And that is a very difficult thing and different from in the past where most of your score can be determined as you're submitting your data. And I know a lot of you that are on this call right now are going through that right now where you see, oh, I'm getting as close to 70 as possible, but what about this other 30 points? So the difference between traditional MIPS and MVPs, you have for the quality side, traditional MIPS is 6 measures, MVP is 4. With streamlined measures that are more aligned with your practice, you'll have fewer measures to track. Obviously, it also limits your measures and measure choices, but if you have the right MVP and you're able to really take a look at what you can do to perform well in 4 measures, it could be very beneficial to your practice as well as reducing the burden for your staff. Improvement activities, traditional MIPS is the full requirement. So if you're a large practice, that means you have to do 2 high or 4 medium or a combination of that. And small practices is either 1 high or 2 medium. Weighted measures for MVPs, everybody's going to have to do either 1 high weighted measure or 2 medium weighted measures, no matter what size your practice is. Cost, I think in traditional MIPS, you're scored on all eligible cost measures. If you're a multi-specialty practice, if you are a practice that utilizes MPs and PAs as and they're billing Medicare, you can be subject to measures on the cost side that you can sometimes in some of these MVPs eliminate that exposure. So that's a big thing. One of the main things is the TPCC measure, which we'll get into on the next couple pages. That's the total per capita of care, and over 40% of clinicians are given a score for TPCC according to CMS. And with that, you could have practitioners that work in any of the specialties that are out there that are getting basically created as a primary care practitioner. So that's something really to look forward to and hopefully utilize this as a chance to get out of some of the cost measures. So, in feedback from our previous webinars, one of the main asks was to dive a little bit deeper into certain specialties. For this one, I did pick out two specialties to compare what it looks like or what it could look like for reporting traditional MIPS compared to MVPs. Um, Gives you really a clear look at what you could do from your specialty as well. But under traditional MIPS, you can see here the inclusion of measures 47 and 134 under hematology, not necessarily 100% related to the practice of hematology, but under MVPs, you can reduce that just to these measures that line up with the specialty. The other thing that you see here is with the improvement activities. I have four choices for the improvement activities under traditional MIPS, or three, I'm sorry, one high and two medium. But under MVPs, they'll only need to report on the one high measure. And last but not least, for the cost category, what you'll see here is the total per capita cost. Happens to be the only measure that hematologists are normally associated with. There may be some changes for 24 and moving forward, but under MVPs, they still will have that as an option or as part of their cost score. So there's no change for costs for those groups. The next group that I'm going to show are our mental health providers. So under this, you'll see under traditional MIPS, once again, including measures that have been around for a long time, are hard to score well on for the most parts, advanced care plan and documentation of current medications. They have very tough benchmarks to go after, but you can see here there's 6 quality measures on the left-hand side, and then on the right-hand side there are a lot of opportunities to utilize some very specific measures towards the mental health industry, including MBHR2, which is one of our measures here at HealthMonix in our relationship with the American Psychological Association. There are some other opportunities to report QCDR measures within this mental health program. Improvement activities, once again, really just being able to limit the number of measures that you need to report and the burden on your team. And for this one of the main things that you'll see in differences is that under traditional MIPS, a lot of the mental health places utilize mid-levels, your NPs, your PAs, and so forth, that are going to be associated with total per capita costs. And sometimes with those patients, that score can be very, very low. And with that, you know, doing an MVP can eliminate you from the exposure to that measure because you will only be scored on the 3 measures that you see on the right-hand side of the screen if you are doing the MVP. I am going to turn it back over to Mara. And if you guys have questions, there's a couple that have come through, but if you have some questions, this is a great time to get them in. Thank you.
Sounds good. Thanks, Mike. So finishing out the conversation on MVPs, just gonna touch on scoring and benefits of MVP reporting. So MVPs might not be the best option for every group, but that's going to depend on a lot of factors, including, like we've discussed, specialty, provider type, and then also what resources you have available to you. But in order to make that decision and maximize the benefits of reporting an MVP, like we've discussed, there are a few things that you should be considering early on in the year so you have time to make your plan and adjust. So, understanding your needs, selecting the correct MVP, customize your implementation, and then optimizing the quality measures. So, our goal, we want everyone to make sure that all of our groups are engaged in this process to make it work. And that's going to include selecting a clinically relevant MVP and then truly taking the time to make the necessary changes through your implementation of the MVP. So it will be a change from traditional MIPS. Your workflows may look different, but we encourage all our groups to take a look at it, consider if it might be the best option for you, and we're happy to help with that process as well. We can always discuss based on what we've seen over 2023 and going forward, if it makes sense for your group this year to engage in an MVP. Next slide. So, wrapping up the MVP discussion, again, just want to recap and emphasize what the benefits can be. If you decide this is the best route for you in 2024, you want to track an MVP, see where you stand, and like Mike had mentioned earlier, this can be an on-ramp year for you. So, if you want to track an MVP and again, see what your performance might look like, you can still end up reporting traditional MIPS. But some of the benefits are, again, related more closely to specialties. So you're going to be assessed through an MVP. You'll be assessed and scored on measures and other activities, improvement activities in PI and costs that are related more directly to your specialty and the work that you're already doing within your practice. On top of that, you only need to submit 4 quality measures instead of the 6, like Mike had mentioned. This just really gives you the opportunity to focus on those 4 rather than needing to cast a wider net and extend more resources on more measures. You're focusing on a smaller set in an MVP. Um, Subgroups also offer a more flexible reporting option, and this should result in more beneficial scoring opportunities. So the addition of subgroups is something that we've seen over the past year that's really benefited groups in terms of the scoring of traditional versus MVPs. And then again, like I had mentioned, you can use this year as a practice year, and as CMS has stated, MVPs will be mandatory at some point in the future. So, this year, next year are a great time to try it out and see where you stand so that you are prepared when they become mandatory. And then lastly, MVPs do more closely reflect other value-based care models that we see that will be important moving down the future as the landscape changes. So some of the resources we have at HealthMonix, just want to quickly run through so everyone's aware that where they can find them. First thing we wanted to highlight is our MIPS ROI calculator. As more providers are required to report this year in kind of the post-COVID world, the incentive payments that we've seen are very significant. So as of last year, 2023, top performers are looking at about a 9% incentive payment. So again, this is a significant increase in revenue, or on the flip side, could be a significant decrease or penalty payment. So we encourage everyone to take a look. This is on our website. It's important to just consider what you could stand to gain or lose through the MIPS program. And again, this is all performance based. So if you input your Medicare revenue and a potential score, we can let you know what the ROI will be on this program. And then a quick MIPS overview sheet. This will be in the slide deck with the link here. But again, you can download it so you have it handy. Just goes over basic performance, or excuse me, program requirements for 2024 and just some changes for this year. All right, what do we do at HealthMonix? So most of you probably know us for webinars and blogs and the content we create at HealthMonix around MIPS reporting, but more than that, we are truly passionate about helping clients excel in quality reporting through various value-based care programs, and all the while improving care for patients and then helping providers utilize our easy-to-use technology. So how MIPS Pro helps you report? MIPS Pro is our registry product here at HealthMonix. So the combination of our team being our support team and our integration teams, coupled with our first class technology, really sets us apart in the MIPS world. So our ultimate goal is obviously helping clients avoid any penalties that are assessed based on performance and value-based care programs. So here's just a quick shot of our dashboard, very easy to use, very user-friendly, and again, showing we can help you avoid the penalty, and we'd love to discuss how we can help you do that. And then I'm
All right.
gonna send it back to Mike.
Thanks, Mara. There are some excellent questions that I'm going to try to get to today. There are some that are very specific to individual practices, but for the most part, a lot of them are relatable to everybody that is here. Just on this screen here for you to see, you can reach out to me here at mlewis@healthmonics.com or my phone number that is listed there. Or if you visit mipspro.com, you will have the ability to reach out to our support team or our sales team if you haven't purchased yet with questions about what it looks like for you. Just to let everybody know, I saw a couple hands raised. We're not going to be taking live questions today, but if you add your question here under the question queue, I will attempt to get to it today. So I'm going to see if I can run through a couple of these and see where we go. All right. The first question that I see here is, can you report quality measures for MVP via ECQM or must be MIPS CQM? Great question. You will have the ability to report MVP quality measures in every single way that you are able to report for um, for the measures in under traditional MIPS. So if you want to report MVPs through ECQMs or MIPS CQMs, you can utilize a registry like ours where you can do both at the same time, or work with your EHR to report those ECQMs. All right. Also, a good time to get your questions in now. I was told that once you pick an MVP group, you cannot change it. Is that correct? Under current guidelines with CMS, yes. If you have to go in and choose your MVPs within CMS, not within our platform, but within CMS, that you can't change it after that. So that is true. Another person mentioned that, there, while the number of measures is reduced to 4, there are less to choose from. MVPs often don't have the options to choose from. You're 100% correct. I think they did a much better job in 2024 MVPs to start including measures that had benchmarks or that aren't completely topped out. However, we aren't 100% of the way there yet. Some of the new measures that were added for 2024 can help you by having minimum scores of 7 points. However, you are 100% right that there still is not a decent number of measures across the entire landscape. But that also includes traditional MIPS. As I stated earlier, many of the CQMs that are out there for traditional MIPS are highly topped out and benchmarks are gone. All right. This is a small practice that is looking to move into the advanced cancer care for 2025, and getting to how's the chance to getting up to the points needed, the 40 over 40 or six, in this case 40 points needed to maximize your quality scores. You're 100% correct. This is not going to be easy for any specialty across traditional or MVPs. However, by reporting both options, traditional MVPs at the same time, you can maximize your scores. But many of these measures are topped out at 7, as I've stated a couple of times, as well as some have that you need to be at perfect 100 points, 100% to get your 10 points. So it is very difficult to get 10 points moving forwards. MIPS is not the same. it won't be the same. A quarter of the providers in 2023 are expected to actually um, fail for this. So there is the option there to, or not option, understanding that MIPS is not the same as it was in years past. Dun, dun, dun. Oh, lots of questions. Look at these. Does HealthMonix have individual MVP dashboards? In 2024, we have individual MVP dashboards will be live, and you'll have the ability to track MVPs as individuals, groups, subgroups, traditional MIPS, and MIPS all within one program. So you do have that option. There's lots of questions to go through. Hold on, I'm getting to the next one. If an MVP is reported by an individual within the 10, if the rest of the 10 reports a group using MVPs, does that individual need to be part of it? Yes. 100%. If you are reporting as a group, you need to include every eligible clinician under that group for reporting. Now, if you have one reporting as an individual and then everybody else reporting as a subgroup, you could do that as well, I guess. But yes, you will need to include any time, no matter how reporting occurs, if you are part of group reporting under traditional MIPS or MVP, every eligible clinician under that group will need to be part of the equation. There's a couple of people that have asked if there's MVPs for podiatry, MVPs for dermatology and plastic surgery. If you don't know, that's my long history is um, in those three specialties prior to me being here at HealthMonix. And I am looking forward to the day that you do have better measures and better things. However, the MVP for dermatology is supposedly up, well, not supposedly, it is up for 2025. There is not a 2024 for dermatology in those groups. So there will be for 2025 now that they have a cost measure as well. So you'll have that there. The slide deck as well as the recording of the webinar will be sent out to everyone. Um, uh, just to let everyone know here too, and this is actually brought up by someone here at HealthMonix that I forgot to ask the question, but you need to go to CMS to sign up for to sign up for an MVP. You have in between April 1st, so it hasn't opened yet, and December 2nd of 2024 to sign up for an MVP. The other important dates to understand too is that you needed to sign up for 2023 MVP by November of last year. And then if you are doing the CAPS for MIPS survey, you must sign up and register prior to June 30th of this year to do that measure. Um, Some of the specialty ones, I don't know many of the other specialties. I know that GI and dermatology are coming in 2025. I don't know if they are here for if there are other specialties that are up for debate for 2025 right now. Someone asked about, and I can't find the question right now, about reimbursement for 2022 reporting in 2024. The top performers who got a perfect score in 2022 are receiving an 8.25 percentage increase in their uh, 2024 Medicare charges. So there was a significant increase. That was the last year of the exceptional performance bonus. That goes away, but with the difficulty of the program as well as the removal of the COVID exemption, there are a lot of um, options for uh, moving forward. Uh, Another question here: how often the MVP dashboards and HealthMonix uh, update? So our dashboards update every time we get data, mostly within an hour or so. If the data needs to go through any of our integrations, it could take, a day or two, but our dashboards are updated as we are getting data. Um, That is most of the questions. There was a lot more that came in. If I didn't hit them during this conversations, I will provide those answers to you as soon as possible. So thank you everybody very much for participating in this webinar today. We look forward to getting you on to the next webinar as we move forward into the 2024 reporting and escaping the 2023 submission season, and really appreciate your time today. And please let me know if you have any questions. Thank you.